Something as simple as how we sit or what we eat can artificially raise our blood pressure readings. A lot of us check blood pressure at home because we want to stay healthy, so knowing how to check it the right way and avoiding common mistakes can make the difference between having good control of your blood pressure and being on more medicine than you need, or medicine you don't need. I'm Zane, a board-certified primary care doctor, and in this video we'll talk about how to make your blood pressure readings as accurate as possible by pointing out the 3 most important things to consider when checking your blood pressure, including going step by step through how exactly to do it. Blood pressure is the body's way of sending oxygen and nutrients through the bloodstream to cells and organs that need it, like muscles that have to move or intestines that need to digest. And our bodies often respond to both physical stressors and emotions the same way, not knowing the difference, so blood pressure rises during both tense and happy conversations, and when browsing social media too. So in order to get a true sense of our baseline blood pressure, we have to minimize the demands on the body by settling down in order to let the blood pressure settle down as well. So before checking blood pressure, use the bathroom if needed. A full bladder can raise the systolic blood pressure, the top number, by over 30 points. The diastolic pressure, the bottom number, can go up by more than 15 points. Crossing your legs could raise systolic pressure by almost 10 points or millimeters of mercury, especially in people with diabetes or hypertension. To be as relaxed as possible, it's best to sit with both feet flat on the floor in a chair where you can keep your back straight and supported, something like a dining room chair. Now here's a key part that a lot of people miss, but it could really level up the reliability of someone's blood pressure readings. You ready? Before you check, sit down doing basically nothing for 5 whole minutes, like no talking, with the TV off, and just relaxing. For real, for 5 minutes. It can take that much time and sometimes longer for blood pressure to settle, so not waiting 5 minutes can result in higher blood pressure readings. So enjoy resting quietly and sitting still, relaxed, calm, and hopefully even meditative, which actually could possibly have some mental health benefits too. When blood pressure is checked matters too, so here's some more things that can affect blood pressure. Caffeine or nicotine can raise the blood pressure by over 10 points for around 30 minutes or more when they're floating in someone's system. Alcohol can both lower and raise blood pressure while it's in someone's system, and even for a few hours afterwards, but it's ultimately harmful to the heart and blood vessels in the long run. Exercise is like the opposite of alcohol. It can raise blood pressure in the short run for half an hour or more afterwards. Overall though, exercise lowers blood pressure safely and effectively and is actually recommended for most people before or in conjunction with medicines for high blood pressure. When we eat, extra blood gets redirected to our GI system to digest and absorb parts of the food that we consume. This is one reason why blood pressure can drop up to 6 points a few hours after a heavier meal. Emotional and physical stress can falsely raise readings too. The white coat effect is real and can raise blood pressure up to more than 25 points, partly from the stress of being at the doctor's office. Exposure to cold temperature, another form of stress, can make systolic pressure jump by more than 30 points and diastolic go up by over 20 points. Being sick or having joint pain like in the knees or back can affect blood pressure readings as well. If you like numbers like me or you're just curious, you can use this principle to see how different things affect your blood pressure, like meals, exercise, and stress, but keep in mind, resting blood pressure is what's usually used for the diagnosis of hypertension. Depending on your condition, recommendations might vary for when during the day you should check your blood pressure and how often. If you have no idea where to start, one option that might work for some people is to check at least 2 readings 1 minute apart in the morning before taking any medicines, and then again in the evening before dinner. As far as how often to check, a daily log of blood pressure readings can offer valuable information to healthcare professionals, but everyone's case is different, so talk with a healthcare provider to discuss the right frequency of BP checks for you. People with hypertension should consider logging their blood pressure at least once a week, and in the week before a clinic visit, consider logging it every day and bringing the log and your blood pressure machine to the visit. Whether you're a software engineer, an athlete, or a Marvel superhero, knowing how to use the tools you have is crucial, and for blood pressure machines or monitors, it can improve the accuracy of the readings. Place the cuff on bare skin if possible, on the biceps area with the bottom of the cuff hitting the bend of the elbow. Keep the arm supported on a flat surface like a table with the upper arm at heart level. Dropping the arm too low or having the arm unsupported can raise the readings. And tighten the cuff so it's snug but not too tight. Proper technique can only take you so far if the machine isn't accurate. If you watch my blood pressure monitor review video, you know that validatebp.org has a list of validated and accurate blood pressure monitors, or blood pressure machines as some people call them. There's a similar site in Canada too. You also have to consider cost, how easy the machine is to use, how easy it is to store and travel, and the durability. Having a cuff that's easy to use with a built-in memory is important because you can compare your numbers over time and bring the machine with the stored readings to the doctor's office. You can even step it up a notch and get one that syncs to the health app on your phone, making it even easier to track. No matter which cuff you get though, make sure it's appropriate for your arm size. Certain devices will have their own range of compatible arm sizes that would probably be listed in the packaging or the company's website, but here are some common cuff sizes for a large amount of blood pressure machines out there. Now that you know how to get the most accurate blood pressure readings possible, you might be wondering what the numbers even mean. What numbers are too high and why are there two numbers? I talk more about that in this video over here. Peace and see you in the next one.